I'll hand you over to our host for the day, CEDIL's Research Director, Howard White.
Thank you, Saul. So welcome everybody to the CEDIL conference for 2023. CEDIL, as you hopefully know, is the Centre for Excellence for Development, Impact and Learning, which is a DFID, formerly now FCDO funded programme, so supported by UK Aid and the British people over the last 5 years, working on methods innovation for impact evaluation and systematic reviews. So this is the first day of the conference. Will take place over the next 4 days. So we have interesting sessions each day, including on Friday with a retrospective looking back at CEDIL and what we've achieved, because we're coming to the end of CEDIL now. It's been a 5-year programme. This is the closing months we're in now. So as Saul mentioned, we have a Q&A function, and so you are encouraged to put questions in the Q&A there during the presentations themselves, because the speakers have an opportunity when they're not speaking to reply live in the Q&A to the questions. So do use the Q&A button rather than the chat button to send questions. You can stick your hand up. We're going to have a couple hundred people in the session, hopefully, and so more likely to get answers to your question if you stick it in the Q&A, I think, but by all means do feel free to raise your hand. So the format is we're going to have short presentations, a bit of discussion amongst the panelists, and then go to the questions. I will read out the questions that we pull out as the ones that are going to be taking the conversation forward. Yes, what's this session about? You should have said. So the session is the future of impact evaluation. So we deliberately picked quite a broad title that should have a broad interest. And I'm very pleased to say we've got 4 leading people from the field, both on the research side and on the practitioner user side for impact evaluation. I'll introduce them each very briefly. I don't think anyone needs an introduction as we get to them. So we're going to start with Annie Duflo and Ariana Lugavani, followed by Timothy Lubanga and then Gonzalo Hernandez. And so Annie Duflo has been for a number of years now the Executive Director of the Innovations for Poverty Action, IPA, and we'll hand over to you first, Annie. Please go ahead. You're muted, Annie.
Of course. Good morning, good afternoon. Thank you so much for having me. It's a great pleasure to have been on the advisory board of CEDIL, and it's a great pleasure and honor to be on this panel this morning with this great group of people. So since we're talking about the future here, I started by reflecting on the past 10 years. So 10 years ago, one of the things I was doing is working with the Ministry of Education in Ghana to promote and evaluate a local context adapted version of the teaching at the right level approach. So the goal was to understand how an approach that was demonstrated to be successful in a different context, India, could be adapted to the Ghanaian context, and to evaluate the impact of this new version in this new context at scale when implemented by the government. Fast forward, the teaching at the right level approach has been integrated into an education plan and is planned to be scaled. Now, this wasn't a straight road, and certainly not just the result of sharing this evidence years ago. This was really the result of years of partnership between IPA, the Ministry of Education, and others in the ecosystem to build a broader culture of using evidence and data in decision making. So this experience, as well as many other experiences, have informed us at IPA when we developed our strategic ambition five years ago. And as part of this process, we laid out what we saw as the critical pieces that need to be in place for evidence and data-informed decision-making to happen. As we are all well aware of, the existence of evidence is only one of these pieces. It needs to be credible and relevant, of course, but it also needs to be accessible and to the right people at the right time, and that's really important. Then there needs to be buy-in from decision makers for the use of data and evidence, and a broader culture of using data and evidence. And finally, there also needs to be know-how and resources for scaling evidence-based intervention or putting in place mechanisms to use data. So underlying this puzzle is the really key understanding that how and with whom we conduct impact evaluations and generate evidence more broadly is as important as the evidence itself. So now I'll describe what we have been thinking about needs to happen for these pieces of the puzzle to come alive and to come together. That has informed our own strategy, but also I think in a way that reflects the journey of the broader evidence to policy ecosystem, this journey from impact evaluation to evidence and data informed decision making. So the three elements that are key for this puzzle to come into place. The first is advances in methods and data. That's critical for us to be able to increasingly answer more complex questions with increased nuance in our understanding of what's going on. But again, the evidence, the way that we generate this evidence is as important as the evidence itself. And co-creation of evidence is really critical for evidence to be relevant, to be accessible to the right people at the right time. It's really critical for buy-in and for creating a broader culture of using data and evidence. And by co-creation, I mean the process by which researchers and decision makers work together throughout the research process to answer key questions that have been co-identified. So really starting with the identification of the research process. And finally, something that we have realized that in many cases of successful evidence use, it had involved an iterative long-term partnership between researchers and decision makers that went beyond the initial study that may have sparked this relationship. So now I'll lay out what I think some of the progress has been along these three ingredients and what the future might look like. These are three areas that the work of CEDIL, I think, has been very critical in advancing. So I refer you to their great work as well. So in terms of advances in methods and data, the progress in the way that we collect data and in measurement allows us to increasingly answer more complex questions with a more nuanced understanding of the mechanism of an intervention's impact. The use of technology, of course, is key, whether it's digital data collection or use of technology to measure complex things. But it's not just about that. It's also about carefully experimenting with measurements. For example, to be able to measure very sensitive topics like intimate partners violence, or things that are just hard to measure, like parental belief in education. That's an example in one of the CEDIL briefs. So advances in data collection and measurement are key. The use of administrative data also has great potential for our ability to increase the cost effectiveness and timeliness of studies, but that requires investments to ensure its quality. Research designs, the increasingly innovative research designs, and also the potential of integrating machine learning with causal inference also increasingly has been allowing us and will continue to allow us to really expand the range of the things that we can test and the number of things that we can test, as well as expand our ability to interpret results, and in particular our ability to provide more targeted recommendations to decision makers. So moving on to co-creation, what's needed for co-creation is really the investment in long-term iterative partnerships between researchers and decision makers, as well as very specific mechanism to allow this co-creation to happen, whether it's steering committees or design workshops. There is also a nice CEDIL brief about this. Evidence mediators can play a big role in that, in bringing together researchers and decision makers. I think the way that funding for research is structured also needs to be examined. It's usually very study focused, and there needs to be a broader thinking. Interestingly, I think the increased potential of researchers partnering with decision makers at the intervention design that's been brought by the ability to use machine learning and administrative data is really interesting. And a good example of that is in Togo, where researchers from Berkeley and others worked with the Ministry of Digital Economy to refine the targeting of a cash transfer program during COVID. They used satellite imagery combined with cell phone transactions data and used machine learning to understand how to best measure poverty or assess poverty levels at the individual levels to strengthen targeting mechanism. I think this potential of researchers really intervening at that stage, doing really interesting work with this data at the stage of intervention is really interesting for co-creation. And finally, it's really critical for co-creation and for building a strong understanding of the local context and priorities that there is a broader involvement of Global South researchers. It is a multi-pronged challenge that requires a multi-pronged strategy, and there are many efforts towards this. And finally, what becomes very clear through the co-creation process is that decision makers have multiple needs in terms of data and evidence beyond impact evaluation. So it's important to engage in a more comprehensive manner. For example, the use of descriptive data, good responsive descriptive data can be very powerful. When COVID started, for example, we worked with government partners in 9 countries to collect data on socioeconomic implications of COVID to help governments respond to the crisis. And the surveys themselves were co-created. The questions were identified in partnerships with our partners. Strengthening monitoring and evaluation, the ability to rapidly experiment is also key. And for that, the use of admin data is critical. And therefore, the strengthening, the use, the quality, and the integration of admin data. One model that at IPA, as well as others, we've been increasingly developing that brings together all of these components is what we call the embedded lab model. This is a model whereby an IPA team works hand in hand with a government partner to build embedded capacity within a ministry to use data and evidence, as well as strengthen the daily monitoring and evaluation of programs. So the ultimate purpose of the embedded lab is to embed this culture of data and evidence use, and to build feedback loops within the system between data and interventions. And it really encompasses a number of collaborations, including impact evaluations, identification of effective solutions, but also descriptive data, strengthening administrative data, etc. A good example of that is in Rwanda, the Rwanda Education Evidence Lab that brings together a lot of the things that I talked about. So it draws on descriptive work. There was a strong analysis made of teacher turnover and recruitment that then informed the national recruitment framework. It involves strengthening the administrative data infrastructure. It involves scaling and evaluating an evidence-informed intervention that was based on a study that was made of pay-for-performance teacher contracts, etc. And we have a similar model in Ghana with the Ministry of Education to end where I started. So to conclude, I think that the future of impact evaluations will be enabled by advances in methods and technology, but it will be driven by relationships. So we need to invest both in, this is really about cultures as much as it is about interventions. And I think that the work of CEDIL has been instrumental in all these aspects. Thank you.
Thank you very much, Annie, for the very insightful and on-time presentation. You mentioned at the beginning the work on teaching at the right level in Ghana. So CEDIL did fund a teaching at the right level project under our mid-level theory transferability program of work, where the team did a review of teaching at the right level, determined what factors affect effectiveness of the intervention, and found, unsurprisingly, fidelity to the program, which meant in this case assigning children to the right level for teaching at the right level really mattered. And so they then did a further study in Botswana, I think it was, which then tested whether this seemed to be the case, and found indeed that it was, and then scaled up basically based on that. And certainly the last point you're ending on when talking about the embedded labs, the importance of relationships. Certainly when I was at 3IE and we financed a number of studies under our policy window responding to government demands for impact evaluation. And they were normally trailed by 2 to 3 years relationship building at the start before we got to the point at which we could say, okay, now let's do an impact evaluation together, because you need that cooperation and trust on both sides in order to be able to do that. So I think relationships are key in working in the policy space and the evidence space. Thank you for that. Okay, our next speaker is Ariana Ligavani, who leads the Development Impact Evaluation Initiative at the World Bank, again for several years now. And so Ariana, please, over to you.
Thank you, Howard, and thank you for inviting me to this exciting event. I should say that I started this work in 2005 when I joined the World Bank to start this new group. The idea of this group was to actually change the technology for development. I had worked in the operations of the bank earlier in my profession and realized that the technology itself for development needed some updating. And it took us quite a bit of time to demonstrate the power of a new way of doing development. So I want to talk a little bit about that, but also want to put it in the context of today's major crisis. And the economic prospects are not very favorable, and we are confronting, of course, many crises, from conflict to climate and pandemics, which have raised the awareness of the need not only to increase development action, but actually making that development better. So today I want to talk a little bit about what better development looks like. And I want to start with the instrument that development institutions use for acting on economic development, and that is our projects. I don't seem to be able to move my slide. Oh, well, there we go. So I want to start with this basic concept, which is that the very instrument that we use for development, which is development project, has an antiquated technology. The preparation is costly, usually delayed, with a very low evidence base. The designs are predetermined and they're kind of jump in the dark, and there is very little support being provided to implementing agencies. There is very little evaluation on average, and if it's done at the end. So the bottom line of that is that these projects deliver impact below production frontier. And so the question is, how do we move from here? So I'm going to report on, so we have been working on this for about 2 decades, but we had a 6-year large-scale pilot financed by the UK and many others that we have used to report the very rigorously on the impact of these products, these impact evaluation products, to demonstrate the power of data and evidence in transforming the impact of our development operations. And basically, what I'm going to discuss is the fact that very, very small investments into these technologies can double the impact of our operations on the ground. So what is this new technology and what does it look like? So we have implemented a batch approach to hardwire evidence in project design. And I'm going to discuss a little how much just hardwiring evidence in project design can bias. Then trialing different ideas early in project implementation and adopt better ways of doing things that actually projects on a different trajectory of impact. And third, and very importantly, building local capacity to manage for impact. Now, the basic idea of batch wiring in of evidence is to use workshops that I initially developed in 2005. These workshops have become kind of this global standard on bringing clients, researchers, and project teams together to train and discuss and operationalize existing evidence into project designs, but also entrench into designs this idea that we don't know everything and that we should understand and learn what is to be learned in the process of implementation. And to do so, we need to build capacities in implementing agencies to actually manage the delivery of development operations in a different way, which is in a kind of trial and adopt, what I call today a trial and adopt technology. The idea is to make a big push in to change projects and their impact on the ground. The trial and adopt approach is one that has gained a lot of popularity, but it's still applied to a very small percentage of development operations. The idea is really to understand what works best, this or that, to turn left or right. And as we develop very rigorously the evidence regarding which of these options are more effective, we can act, governments, implementing agencies can adopt the better way of doing things and kind of rise the trajectory towards greater impact. Now, the idea of using evaluation early in project development, of course, is that we can affect the impact of that project in real time. Not only that, but by working through a programmatic approach of working with many governments and many countries at the same time on the same policy questions, we can actually cross-fertilize and learn much more as a group than we would in isolation, and being able to affect the impact of many different projects and policies at the same time across the world. And that makes it very, very exciting, and in terms of returns, provides a very, very strong bottom line to this type of work. The idea is not to come in and out, but very much, as Annie said before me, to kind of work in an iterative way for very long periods of time, putting capacities in agencies and supporting them through the whole process of using data and evidence systematically, while at the same time building their capacities for managing for greater impact, and select both on the implementation sides and on the selections of what works, very much incorporating data and evidence in their daily decisions. Now, this takes me to the importance of really focusing on the capacities of implementing agencies. And I see this in three parts. The first is that through these single projects and operations, we can place capacities in these agencies to improve their data management systems, their skills and digital tools. And this is shown to speed up disbursements, increase compliance with plans, and increase development impact. It also leaves capacity beyond projects for governments to use across their sector portfolios. Now, the second item, and I think this is something that we are working very consistently now across many governments, is to teach them to use their administrative data and help them develop the tools to use the administrative data to improve their government functions. What we have found is that even light touch interventions can very much help governments improve workflows, address inefficiencies, and reduce delays. In the sector of justice, for example, we see improvements in efficiency from 20 to 40%. And thirdly, and this is something that comes from working from the economic side and thinking about connections across sectors, and developing integrated low to high frequency data systems for cities and for countries that then can be used for the purpose of economic management. This is really exciting, and I think if we are thinking about the future of impact evaluation, these are the areas, building capacities in countries to use data in a much more forthcoming and integrated fashion that I think have huge potentials and still unexplored potential. So I want to make a general point. Kind of moving from the status quo, where a very small percentage of operations are put through what I would call a trial and adopt technology, moving from where we are to a much greater and at scale approach to trial and adopt can really help us learn from past mistakes, rank interventions by cost effectiveness and effectiveness, and really maximize the impact. What we see, as I said earlier, is that return on investment can go from what it is to twice as large an impact. For an organization like the World Bank that lent last year $70 billion, I see this as doubling that 70 billion to 140 billion if the World Bank were willing to move this technology to scale. I want to give a couple of examples, and the examples here draw from the whole literature of, this is a large community of researchers from academia and many other organizations working really together to develop knowledge about things that we should be investing more into. And so, when we come to an area like poverty reduction, where we have made sustained improvements for many years with, a more recent setback in association with the pandemic, we need to, realize that many institutions are still not taking that evidence to heart in terms of how to make use of their resources to reduce poverty most effectively. So here is, a very short review and superficial review of this literature, but basically a literature of 38 randomized controlled trials, all pointing to cash transfers as a very effective way of reducing poverty. At the same time, we know that community-driven development from at least 8 randomized controlled trials, we see zero impact on poverty reduction and very little impacts on anything else other than the infrastructure built. So when we're thinking about big portfolios like at the World Bank, 33 billion still on the books on community-driven development, and only 5 billion put around cash transfers or cash transfer plus programs, we see a real need to reallocate funds and reallocate energies away from one type of program towards the other to provide a support to an area of certainly of evidence that is being very, very critical for all the different policies that we are considering, including just transition in decarbonization, food security crisis, and many other situations that require an arm into transferring resources effectively to poorer populations. I want to give you another example. This comes from a multi-country randomized controls studies looking at performance-based incentives in health to improve maternal and child health outcomes. And here we see something quite interesting, that when different type of incentive programs are stacked side by side, performance-based incentives scores as well as direct facility financing and as well as financial incentives to mothers, but the cost of these different type of interventions are very different. And so direct facility financing and financial incentive to mothers, for example, cost about half as much as performance-based incentives delivering the same outcome. This is a case in which we can select, we can use this research to actually select things that can double the coverage of mothers in Africa and reduce and improve significantly their likelihood of survival. So this is also quite exciting. I want to give you one more example, if I have time, one which says, okay, how do we work with these projects to actually iteratively change the way they deliver on their promises? Here is an example from Ghana, where a sustainable land management project targeted reforestation as one of its objectives and provided seedlings, tree seedlings to farmers to increase tree planting. And during the first phase of this project, they found that they were way below target in terms of tree plantings. And so they came to us with a question regarding, you know, how can we incentivize or how can we improve the bottom line on reforestation? We suggested that we try some financial incentives. And as you can see from this chart, financial incentives tripled the number of farmers that were willing to plant trees. And so the project took this recommendation into its project design and was able to meet the targets that they had set for themselves. But it turned out that these incentives were quite expensive and the participation was really high. And so in the next stage, we actually conducted a uniform auction to understand how to optimize the incentives, not to maximize participation, but to maximize overall impact of the project. And we found that about half as much provided in incentive could still retain the majority of farmers, but would free about half of the budget and allow the project to double its size. The government took this work in consideration in the design of the follow-up project. This was a $60 million follow-up project that fundamentally delivered as much as $120 million under the previous design. So this is a case in which we can use research and we can use being there and working with government interactively in this co-creation project process that we all agree is the way forward to deliver better value for development finance and better value for the efforts of government agencies on the ground. So to summarize, you know, the type of work that we have been doing as a community from, you know, so many organizations all across the world working on data and trialing different ways of doing development shows that we can literally double the number of mothers covered in some of these programs, double the amount of trees planting and so forth and so on. And so the question is not just how much more we put into development, but how much better we want to make sure that that development finance delivers on the ground. even when we only use our efforts to inform new designs, we find that we can make a huge difference in the delivery of those projects. And this is an example from Tanzania, where in 25 years of investments in water points, we did not see any increase in water access. And the question is, why? And so as we walked into this environment and started collecting data on the water points, we found that almost 60% of these water points were broken down for more than 1 year at a time. And so the investments clearly are not enough. Constructing is not sufficient. So we did a lot of qualitative research in this case, looking at the issues of technical constraints, financial constraints, organizational constraints for the maintenance of water points. And we provided a lot of input into, we have made this learning from a UK program and kind of exported them into a World Bank project to inform the design of that project. That project included user fees, results-based financing, and established a new rural water supply agencies that in only 2 years, increased water access by 50%, from 40 to 60%. So this is quite exciting, and clearly we hope that in another 2 years we'll have even better news. But the point being that it is not that projects that do not use data and evidence kind of are working with one arm tied behind their back. By injecting a lot of information into the decision process, design and operational process, we can make huge strides into improving the ability of our efforts to result in great advances in welfare and economic well-being. So I just want to close by saying that knowledge is a core public good. We, as a global community working on this type of knowledge, should be proud of the achievements that we have made so far. But we need to push that envelope even further and work collaboratively to clarify to the financial world, to the donors, that this is actually an amazing investment into the future. And that financing for knowledge should not be an afterthought, but it should be part and parcel of development financing moving forward. Thank you, Howard.
Okay, thank you, Ariana. Thank you for that appeal at the end for more funding for the global public good of evidence, which of course you and I believe in greatly and which we've seen diminish somewhat in recent years. And so I think the sort of evidence you present of the difference we can make by using evidence is really important to get in front of the right people, for them to understand all the people managing these global funds with millions or billions of dollars that have insufficient use of evidence is really somewhere we ought to be going, jointly, all of us as a community, to really shake them to realise how under-realising their potential by not using evidence sufficiently. I have been struck in both your presentations, there has been, I make a distinction, most people distinguish between quantitative and qualitative. I think the most useful distinction between factual and counterfactual evidence. And there's a need for factual evidence at various points in the decision-making process. And so the example you gave of 60% of water points are not working more than 12 months at a time. That's just like a piece of factual information. There's no counterfactual required there. What to do about it does require counterfactual analysis, but just pointing to the extent of the problem and what the problem is just a really important piece of analysis at the start. Danny made some similar gave some similar examples in her presentation, talking about work IPA's been doing on M&E, for example, in these embedded relationships that they're developing. Okay, thank you very much. There's been 2 presentations from the researcher side. Now we're going to move to people who are in the business of both commissioning but also using evidence. And first up, we have Timothy Lubanga, who is the Commissioner for Monitoring Evaluation in the Office of the Prime Minister in Uganda, and has been there for several years and worked actually both with 3IE and with Campbell Collaboration in that capacity in the last few years, for example, on the country evaluation map that we did together for Cameroon, and been using that, so he tells me, in their work in the government in Uganda. So Timothy, over to you.
Thank you very much, Howard, and greetings to you, all the panelists, and all the participants attending from wherever you are. So I am really honored this afternoon to share with you some of our thoughts, both as the evaluation family here in Uganda, but also in my role as a member of the Trendembele, which is an African regional effort. We have been discussing this, and I think we have some thoughts that I will be happy to share with you as part of my sharing this afternoon. So thank you so much for inviting me to present. So at the outset, our objective really is to increasingly continue to inculcate the culture and practice of generating evidence, but more importantly, of using the evidence that is there in the policy making and in the management of the affairs of the public sector. We have achieved a lot over the years, but we also have identified many areas where we think that our thoughts going forward will be informed by our experiences. And particularly for this afternoon, my sharing is informed by three things. One, we have just completed a midterm review of our National Development Plan, which is the third phase of the National Development Plan. And the review had some very striking findings, which are quite relevant to where we take impact evaluations and the whole practice of evidence forward. And secondly, we have also just issued our poverty status report, as well as the latest household survey, which is not so old. And those reports have come out with some findings which have been really, really inciting the policymakers. For example, that in some parts of the country where there has been a kind of an overload in terms of investments in livelihood programs, poverty levels have actually gone up. And so the policymakers are questioning very, very strongly, what is the impact of these projects? Why is it that despite heavy investments in livelihood programs, which was expected to reduce the poverty levels, actually the poverty is going up in some of the areas. And so those have informed kind of our proposals on what we need to do in terms of being innovative, taking forward impact evaluations. So the first thing that we think we should do is kind of structuring a point related to what Ariana said, structuring capacity development and particularly training with the policy making and policy management processes. So we have come together with a couple of universities, and particularly we have a program with Makerere University, which is our kind of like the oldest and most traditional university here, to design through a program called IEED, Impact Evaluation for Decision Making, a package where we want to structure a training program within the university and have a consistent training scheme and relate that training scheme to the programming and policy making within the public sector, so that we eliminate that linkage. Because what has been happening is that we would have sporadic training programs here and there, and then we have no relationship with the research agenda, the interests of the policymaker, and that linkage was really not very helpful at all. So it weakens our objectives of promoting evidence generation and use overall. So that's our objective. And we think structuring this capacity building effort does not end at the training, but also goes ahead to link the research that is undertaken across in the national research environment with the requirements of the policymaker. And we need to follow that through on how much evidence is used in the policy making, but also in the policy management processes. So that's one of the innovations that we think we should practice, and we have already started working with the Makerere University to design a program in that direction. The second is to work on data. So it's quite common here, and we have, as Howard said, we have quite a good history of commissioning evaluations, increasing the practice, and promoting the use of evaluations, and we have done this for quite a bit of time now. But we want to go to another step, and so we think that we need to harvest and take advantage of opportunities early. In Uganda, the government has introduced the parish development model, which is a big, popular program, basically meant to decentralize service delivery further from the local government level, lower local government level, to a further community-based level called a parish. So over the years, government has realized that probably decentralization was quite effective from the central government to the district level. But from the district level to the community, there is still a big gap. And so government adopted a new policy on the parish development model to take the services closer to the people. And it is a very extensive program, seven pillars, and a lot of energy, a lot of involvement of the executive. The whole cabinet, for example, this week is in the constituencies to mobilize the citizens to support the program. And so we want to take advantage of this kind of initiatives to inbuild our evaluation programs so that we are able to demonstrate evidence, because sooner or later, our experience from the past is that the government is going to be demanding evidence that these programs are working. Sooner or later, we'll be asked to provide evidence. And the earlier we harness and build these systems, the better. And for the parish development model, we are already working on designing an impact evaluation for only 2 of the pillars, not all the 7. And we think that that's the way we should go. The third issue I want to speak about is on data. And so many times from our experience, when we commission an evaluation, we have challenges of availability, but also on data quality and data availability. And learning from our past, we are working with the Bureau of Statistics to do 2 things. First of all, to strengthen the capacity to manage good quality administrative data, because to a very large extent, the evidence generation is based on the data generated administratively. And number 2, to inbuild and expand our national surveys to incorporate as much information as possible, informed by the programs that are in our evaluation plan. So what we do is we ask each of the 20 programs to come out with a list of their evaluation priorities over a period of time. And based on that, we work with the Bureau of Statistics to kind of anticipate or outline what kind of data we will be expecting to use in evaluations going forward. And we think that this is going to go a long way in reducing the gap and the linkage between the data that is available and the data that we need when we're doing these evaluations. As I conclude, I just want to share with you also some of the things that we want to build on. One is leveraging on the existing resources and partnerships that are available. I think Howard already highlighted, we've done a lot of work with 3IE, the Campbell Collaboration, the Africa Center for Systematic Reviews, CLEAR AA, we are expanding that. We are initiating new partnerships with the academia, particularly a couple of universities, both national and global. We are expanding our cooperation with also local based researchers and research organizations. We are looking at how to strengthen the linkage between the private sector, the civil society, and other partners in this exercise. We are looking at new global partners. And the idea is to tap and take advantage of technical skills, financial resources, evidence, databases, and systems that are available to strengthen our system. Howard, I think I will stop here, and I just thought that I should share some of those points which summarize our thinking, our view on where we should focus and kind of where should the innovations be in terms of promoting impact evaluations, but also the generation and use of evidence going forward. Thank you.
Sure, thank you so much, Timothy. It's very encouraging to hear so much work being done by the government of Uganda, both to survey the evidence needs of different programs, to know what sort of evaluation questions they would like to be answered. So we're getting demand-driven studies being commissioned rather than supply-driven to answer the questions of interest to researchers only. And of course, this is being done by government itself. And I didn't mention, I should have done, that of course the engagement 3IE had with the government of Uganda was the government had its own evaluation program, and we only would fund 3IE evaluations that had been approved for the evaluation subcommittee to fit into the government priorities for evaluations. And so when we have this strong lead for and demand for evaluation, then you're able to do that. And Uganda has been one of the leading organisations in Africa, countries in Africa, working now with others to try and develop that model and take that model elsewhere. Through Twindimbile, which Timothy mentioned, which is a homegrown regional initiative across sub-Saharan Africa, of which Uganda is one of the founder members. And so thank you very much, Timothy. So we move, and just a reminder to everyone, please, put any questions you have in the Q&A, not the chat. And reminder to panelists, please feel free to answer questions in the Q&A. Some of you have been doing so already, so then it gets an answer, and there's some actually dialogues going on there. Please do also pay attention to Twitter. The hashtag is hashtag CEDIL23. There's quite an active Twitter feed going on there, so do please tweet there and get some and including some debate going on about something you said, Ariana. I tweeted that got disagreed with. There's a bit of debate going on there as well. And so take a look at that. So our last speaker is Gonzalo Hernandez, who's now director of the multidimensional poverty network. Previously, he was the founding executive director of CONIVAL, the Mexican National Evaluation Agency, and was there for a number of years. So actually, I was talking just now about demand-driven impact evaluations and evaluation more generally. Setting up national agencies like CONIVAL, and CONIVAL really was the leader here, have played a very important role. And it's probably a model we haven't seen replicated outside of Latin America very much yet, but probably will be coming, where you have similar agencies elsewhere in Africa and Asia. They don't play quite the same role that CONIVAL did. And Gonzalo was also on the board of 3IE for a number of years. So please, over to you, Gonzalo.
Thank you, Howard. Can you hear me?
Yes. Yeah.
No,
yes.
Thank you, Howard. Thank you to CEDIL. And it's really an honor to share this panel with Annie, with Ariana, and with Timothy. Last year, Richard Manning, Ian Goldman, and myself, we wrote a paper trying to assess impact evaluations in low and middle income countries for the past almost 20 years. If you remember, 20, 25 years ago, there was a huge emotion about impact evaluations. So we wonder what has happened during these years. And there are three important findings. I'm going to summarize them here. One is that indeed, there has been an increase in the generation of impact evaluations since the 90s, from having almost zero impact evaluation in developing countries published, up to 1,400 impact evaluations published in 2020, according to 3IE repository. So we've been successful in improving the numbers and the generation of impact evaluations. Secondly, in terms of use, of course, there has been some important results. In many occasions, impact evaluations have been used sometimes to expand programs or to keep the program if it's good, to have a dialogue about certain elements, as in Uganda with the family planning evaluation, or learning on education public policy in Peru. But of course, nevertheless, the use of impact evaluation is still a challenge. The big challenge is how can we use the results in a more systematic way? A third finding from that paper is that the local ownership has been very important to generate and eventually use impact evaluations. As Annie was saying at the beginning, this element of co-creation, of working together between researchers, sometimes from abroad, and the government and local researchers is important. Therefore, one important element, and one important reason of why we have increased the number of impact evaluations is actually the full participation of developing countries. And in many occasions, the institutionalization of these elements, which I think local institutionalization of evaluation or impact evaluation is perhaps the peak of ownership in countries. So I believe that the future of impact evaluation is about how can we improve the use. It's about ownership. It's about the role of the developing countries, and it's about institutionalization of the impact evaluation. So we are better off now than in 2000. And the thing is, how can we keep doing well in the middle of challenges, as Ariana was saying? So governments also need other types of evidence. So how can we combine impact evaluation with a more comprehensive evidence ecosystem? For some governments now, evaluation is not a priority as it was in previous governments. Perhaps Mexico is a good example. Even the USA is a good example. Impact evaluations compete with many sources of information now, including fake news. And of course, as Ariana was saying, the funding of evaluation is a big challenge. So let me tell you some of the steps that we have been doing in Mexico from some years ago up until today in trying to promote impact evaluation, trying to promote evaluation in general. So let me tell you some elements that have been in place. It is not true that we planned this from the beginning, but we have taken steps according to the necessities and the needs and according to the politics of the moment. So if you remember in the year 2000, before that, the impact evaluation of progress, I set a very good example in Mexico. It was a very good example, I mean, locally and not perhaps abroad, but for Mexico, it was a very important step to have that rigorous impact evaluation. But if we combine that element with the fact that there was more demand for evaluation politically from opposition parties, because we finally got democracy in Mexico and opposition parties were demanding to show results in a clear way. If we combine those elements, then we have a virtuous cycle, because at that time, 2001, 2002, Congress approved a law to have evaluations for all social programs every year. I mean, that was a bit crazy because we only had one evaluation for a long time, and now Congress is demanding to have evaluations every year. It was crazy. At the beginning, the quality of evaluations were not very good. Nevertheless, this element facilitated the job of Coneval to produce evaluation, and there was a new culture of evaluation setting up in the country. Another important element is that in 2007, the Ministry of Finance was generously asking to have good evidence for all programs every year as well. And that was because of the new budget law about performance systems. Therefore, the mandate for Carnival, the evaluation unit, was how can we deal with evaluation needs from the country? And therefore, we set up an M&E system in which we generate a set of evaluation tools, key indicators for programs, various evaluation tools, design evaluation, cost evaluation. And in the middle, we have impact evaluation, like in the center. So in a way, impact evaluation helps the country to produce and to build a more comprehensive monitoring and evaluation system in the country, where impact evaluation together with other tools were designed at the moment. And then something interesting happened. One of those evaluations that we generate was called consistency and results evaluation. And it was done for all programs. And the idea was to have very concrete questions, yes and no answers. For example, does the program have a clear logical model? Does the program have result indicators? Is the information of the program available on the website? Has the program had an impact evaluation? Which evaluations were consulted for the design of the program? So these were the type of questions that we had on that evaluation. And then we produced a public score for all programs, and we gave a lot of weight to whether the program has had an impact evaluation. And the amazing thing was that programs without an impact evaluation, because they were low in the score, they were starting demanding impact evaluation, even if they didn't know what impact evaluation was about. So we had this huge demand for impact evaluation without enough resources to do that, but many programs asking for that. Of course, in the following years, we reduced the weighting of the impact evaluation question because perhaps it was too much an incentive there, but that helped a lot in keeping impact evaluation in the loop of people. Sometime later, as I said that before in other places, we launched an annual award for monitoring and evaluation, in which we gave a special award to programs with good, rigorous impact evaluation. And this award became so important that the ministers themselves wanted to be in the ceremony with the press. So incentives matter, as Adriana was saying. And the other element that we are doing still now is that in the year 2013, we developed an impact evaluation incubator. So every year, during 1 week, we offer an impact evaluation course for government officials from different ministries. We invite for that week national and international evaluators to help us with the course. Of course, we have theory, and then for the specific example, we ask government officials to bring to the table the programs they think from their ministers they could have an impact evaluation. And during that week, we worked with them in the feasibility analysis of the impact evaluation. Sometimes an impact evaluation is not feasible for that program for various reasons, but if it is feasible, then we work with them on the basic steps for a future impact evaluation. So out of all these projects in these years, almost 25% of those projects seen in the incubator have translated into real impact evaluation. So for instance, last week, Carnival presented an impact evaluation of an urban improvement program. And in the presentation, it was Carnival, it was the university helping with the impact evaluation, and the minister receiving the input from the impact of evaluation. They had good impact evaluation, they had good results, and of course, they had important recommendations. And finally, a very important step towards the use has been to set up a specific mechanism to track recommendations, not only from impact evaluations, but from other types of evaluations. So, I mean, luckily, even by the fact that today we have less resources than in the past for evaluation, even that today the government is not as keen as before on evaluation, it is possible to find 1, 2, 3, 4 ministers who are still interested and who believe that their own performance will be better with impact evaluation. So I stop here, Howard, and perhaps later I'll come back to the challenges for the future in a more precise way. So thank you very much.
Thank you very much, Gonzalo. Actually, we're getting quite short on time. There's one question I'm going to respond to from gentleman at USAID, Lloyd, and some of the answers have been mentioned in passing. And his question was about use of impact evaluations, and he's leading some work on trying to get impact evaluations more used. And they see this barrier of lack of communication between researchers and decision makers and the different incentives they face. And that's something I could talk about happily for hours, so I'll try not to, which is the incentives you face in academia are to publish in journals. And I work across different sectors. And when I first started working public health workers, public health academics, back in the mid-90s, I was quite surprised at what they would publish. And I realized there's a difference between natural sciences and social sciences. In natural sciences, you publish stuff because it's useful. In social sciences, you publish stuff because it's clever. It doesn't matter how useful it is, it just has to be clever. And I've seen useful articles or useful information get rejected or taken apart and stripped out, anything useful in them, and just the clever part remains in what journals are willing to consider to publish. And the idea of building up a body of evidence, like, okay, let's accumulate the evidence and learn what we can about what works and why and for who and so on, just doesn't exist in social science. It's much more in natural science, be here's paper A, here's paper B contradicts paper A, let's try and understand, have paper C that somehow reconciles them and builds up the knowledge. In social sciences, here's paper A says so-and-so, here's paper B says so-and-so, it's different, doesn't agree. I'm going to do paper C, but does something different. And the idea of building up those bodies of knowledge, it's really not there. In intervention research, is what we do, and what Annie does and what Ariana does and so on. In intervention research, there's been a bit more of an effort in trying to accumulate bodies of evidence. And so Ariana was showing some results from clusters of evidence, but they've been funding in Diamond work in different clusters, and that's one step in the right direction. But I'll just mention a few things very briefly. So some ideas have been done by various organizations in this space that proved to be good ideas. So Ariana mentioned the workshops that DIME did, which were basically these workshops that brought together decision makers, program managers, and researchers together for the training. And in the initial parts of those training, they would identify a program that they would like to have evaluated, and then the researchers would work through the workshop on thinking about a relevant design for that. And that was done across all, there'd be quite a number of participants from different ministries and research from different places in that. A slightly different model, which I think has been very, the first one's sort of like a matching process. So you bring together researchers, bring together program implementers, and you match up researchers with implementers for research interested in evaluating the program that's being done by that program. By those implementers. And matching's been done by JPOW, by DIME, 3IE, we did these matchmaking workshops. The idea that I stole, I think, most heavily from when I was at 3IE from DIME was the design workshops, and Gonzalo mentioned design workshops. So they're more focused. That's where you've got a particular intervention you want to be evaluated, and the program managers come, some sector specialists come, they pitch what the intervention is, and then the researchers discuss possible evaluation designs, and then that does usually lead to some relationship between researchers and matchmakers and implementers to go forward and go ahead of that design. And I think those are useful. The problem we saw at 3IE was researcher capture. What I call researcher capture, it's not a term widely used, but basically researchers would try and hijack the intervention to meld it into their needs for answering their research questions of interest to be publishable. And so yeah, I've seen Ariana has a hand up. I'm trying to be short, and so they wouldn't actually evaluate the intervention as required. It's quite a significant problem that we had, and I think actually I know very familiar with the I2I portfolio, and I think and CF before that. I think you see that problem coming up quite frequently. The other thing we did at 3IE was to have policy influence plans, which have since been renamed, but basically the basic idea is the same, which is you have researchers be clear on what the decision is they want to influence in terms of program design, scaling up or whatever. And they have to actually have a plan for how they're going to influence that decision, so they know who's responsible for that decision, how they're going to engage with them, and they had to report back on that engagement with decision makers. And that sort of put in focus on the importance of influencing decisions as part of what we were funding. We weren't just funding research for research's sake, we were funding research for the sake of actually influencing decision making. And the PIPs played an important role in making that focus, and in some cases guiding researchers quite heavily in how to do that, and others said we don't want to do that, it's not our job, and so on. But that played a role. And I'll try not to say too much on this, because what I believe is the future are systematic reviews for evidence-based decision-making products. So in the health sector, you don't have single studies affecting what's done at the global or even national level. It's fine if you've done evaluation of a particular program, that evaluation influences decision about that program in the sort of the test and adopt model that Ariana was talking about. But if you want to use that study to inform global decision making at the global level in other contexts, the way to do that is by putting that study in a systematic review and making what I call evidence-based decision making products like guidelines and toolkits. We do a lot of this work in Campbell. We do a lot of work at work centres in developed countries where these toolkits are really driving decision making across a whole range of sectors based on evidence with systematic reviews. And I won't go on about it now because I'm already exploiting my position as chair. I've got talks online about this, I have papers about this, so I'm happy to anyone who wants to know more about that can get in touch with me. Ariana, over to you.
Yes, thank you, Howard. I wanted to make a slightly different point about these workshops, which is they don't start at the workshop level and they're not matching workshops. Actually, we work beforehand to understand what are the big questions we want to answer with. We usually work with our global practice at the World Bank. We then develop a faculty. A faculty is a combination of internal researchers matched with external researchers to have both kind of incentives, the incentives to have very important questions that are credible and affect policy, as well as making sure that we have also the incentives to publish and make sure, kind of the external incentives are aligned as well. But the point that I want to make here is that then, which is slightly different from the systematic review, is actually to work towards a meta-analysis. And the way we have done that is by establishing DIME Analytics that is in charge of data of increasing quality in data collection and data integration, but also making sure that the different countries use harmonized measurement systems, and we do measure things in the same way, and even are starting to, to the extent possible, because it is a difficult thing to do, to have similar trials in different contexts to be able to actually do meta-analysis, merge the data, and actually provide kind of that external validity, address the external validity directly. One issue that I always have with systematic reviews is there is no control on the quality of the intervention. And so we're generally comparing apples and oranges a lot. And so sometimes we have surprising results, but the surprising results are really because of the quality intensity of the underlying intervention. We call things with the same name, but as Wittgenstein tells us, we can agree on everything except the meaning of words. And in the case of interventions, things go by the same word, but they hardly mean the same thing. So I think we need to be very, very much more rigorous comparing across. So when we compare cash, digital cash transfers, well, that's pretty easy because, money is money. But when we start comparing other type of more complex interventions, the quality intensity issues come to bite. I also wanted to say, kind of a response, just the last thing, in response of what kind of programs to evaluate. In our experience, there has never been one project in any sector that we were not able to add to the bottom line through the intensive use of data and trials. I think almost everything that we do can be improved. So just leaving that message open out there for people to consider how little we do and how many returns will be there if we.
Yeah, I think that's a great point, Anna. So when CEDIL was set up, it was to fill particular gaps in the evaluation. And one of them was knowledge gaps and sector-wise. And so we all know that the majority of studies have been in health, and that continues to be the case. And after health, it's education. After education, it's agriculture, and it's not manufacturing. It's not large-scale infrastructure, and so on. And to some extent, it's not governance, but increasingly it's governance. It's not climate change, but increasingly it's climate change. And what I think we learned through the last, getting on for 20 years now, of the evidence revolution in RCTs, is precisely what you said. Actually, you can evaluate everything. Very much. Unless the intervention itself is small n, then you can use, as long as the intervention is large n, you can use large n methods. And even if the intervention is small n, you maybe can get inside that n and break it down in some way. That means large n methods can be used. But even if you can't do rigorous impact evaluation, some other forms of data can still be useful in just understanding the nature of the problem and trying to identify or most appropriate solutions. So there was a question on which sectors is most amenable to. Well, there are some sectors which are more amenable. We continue to see majority of studies in health and education and so on. But we have learned that you actually can apply this in a very broad range of sectors. So there was a conference I helped organise in OECD, then was at the bank back in 2003, so 20 years ago. It was in March, wasn't it? Exactly 20 years ago. And Michael Kramer came to speak, a paper he wrote with Esther, and he was asked what percentage of development interventions can be subject to RCTs. And he said, well, maybe around 5%, currently it's 0%, so there's definitely room to increase to 5%. And the 5% was a massive underestimate. So people still sometimes quote that, but like no one would stand in the community would stand by that. Now we think it's a much larger percentage. It might not be 100, but it's certainly, the upside of 50 rather than below 50%. I would put it higher. There's a lot of questions that come up, and they're quite diverse. They don't group together very nicely. So I'm going to pick up one that's come in quite recently, and it's as much to the decision makers as to the practitioners. Anyone can pick it up. It's about not having measurements of long-run effects. So the most our impact evaluations are done at end line or a year or two afterwards at most. And there's one of the rationales for 3IE was to divorce the project funding from the evaluation funding, so you can actually do long run studies, but we didn't get many proposals for those. So go back 5 years, 10 years later and so on. And it does seem we really need those to talk about the benefits, because the benefits are not meant to be finishing when the project finishes. So where do we have these long-run studies? And I was actually talking about the other day, the apparent lack of long-run studies on CCTs. There are a few, but there really aren't very many. Are we starting to see longer-run studies? And if so, what are the prospects for having more of them, particularly given the growth of big data that Annie touched upon? Anybody? Okay, Annie, do you want to come to that? Is anything in IPA's portfolio around longer run studies?
There's certainly enough of them.
It's a bit broken up. Could you start again? We can't really hear you properly.
There's certainly not enough of them. I think it's very powerful when that happens. I mean, I think it's important, based on the theory of change, there are cases where long-term measurements, make sense. Other cases where maybe they are not as necessary, right? So if you're looking at, behavior change interventions, you're probably looking at, shorter term impacts on, are you actually changing behavior today? Also, of course, you may want to look at longer term outcomes. So I think it's not always required, and there needs to be a good understanding of when longer term measurements might be, appropriate. When they happen, I think there's been very powerful. And a good example is the deworming study that many people might be familiar with, where, with Michael Kramer and Ted Miguel and others who evaluated effects of the deworming intervention 20 years later, and were able to evaluate the impacts on wages that adults were earning years after the intervention, and now looking at impacts on the next generation. And I think that's one of the extremely powerful things that a longer term study can help with, is for the type of intervention where you might expect intergenerational effects. So I think there needs to be funding, obviously, for those. You also need to set up your study in a way that you can do that. So being able to track respondents is obviously very key. And I think that needs to be, even if you don't know where your funding will come from in 20 years, I think setting up your measurement and your study in a way that you'll be able to track respondents over time is critical. And of course, the use of cell phones and digital data collection and other means really will help with that.
Thanks, Annie. I see Gonzalo, you want to come in on this one. And Ariana's starting to share her screen. So let's go to Gonzalo first and then to Ariana. Gonzalo?
Well, a couple of things about that topic, Howard. One is that when you have projects that don't last that much, it's very difficult to measure later. But when you luckily have a program such as Progresa, which lasted 20 years, and you have institutionalization of the evaluation of that program continuously, of course it is easier to measure things in the long run. Of course, perhaps it was not easy to think in 2000 that you will be doing an impact evaluation in the long run and 20 years later, but you have more elements to do that. Nevertheless, Howard, I just wanted to jump quickly to having said that the communications on those findings, even they are short run or long run, are important. And we evaluators and we the technical people, we need to improve our evaluation skills to policymakers. So let me give you a very short example. For this transition of the new government, there was a special day when evaluators explained to the new government what Progresa was about. And unfortunately, the presentations of us were full of regressions and R squares, and it was a very technical presentation. And the new people coming from the new government, they were not keen on that type of language. So they ended up just didn't understand anything about what we said because the language that we used was not the suitable one. And now Progress is gone. I'm not saying that it's our fault not being able to communicate well on that day. Perhaps politics were in the middle, but I think for the future of impact evaluation, I believe that we have to invest much more on the communication and the knowledge brokering between academics and policymakers.
Yeah, thank you. Ariana, you were going to show us that very nice slide of long-run effects of cash transfers. Do you want to put it back up?
Sure. This is a meta-analysis we did on cash transfers and targeting the ultra poor programs, and it shows all the data points and after how many years each data point was collected after the end of each program. And so you can see this is an area where we have a lot of data, not a lot on the 8-9 year range, but already a huge amount of data that allows us to say when cash transfer program become cost effective. So this is quite exciting, I think. Now, I want to make a more general point, which is that this is something that should be pretty much pervasive every time we have impacts, that is to say, because if there are no impacts at all, there is, but that we today have many ways. So number one is that RCTs, of course, are the fundamental method for being able to do long-term studies. The other methods are not as adaptable to doing long-term studies, number one. But number two is today with high-frequency data, administrative data, and many other sources of data, we can hope to do a lot more long-term follow-up, and even in real time. So to look, for example, we started on resilience doing longer term impact studies, but on 2 months to 2 months data to actually understand the interaction between our interventions and seasonality and agricultural cycle and food security cycles that tells much more about not only the long-term impact, but how these impacts vary over time, and whether, the timing of the intervention and the timing of the impact should be rethought to maximize the use of funds. Back to you, Howard.
Okay, thank you. Yeah, thank you so much, and thanks for showing the graph there, the data you have on long-run effects. Okay, well, thank you, everyone. We actually come to the time we allotted for this session, so I think we have to draw to a close. There are many questions in the Q&A we've not responded to. We're aware of that. Perhaps I don't know if it's possible, Saul, we'll send them around and try and do an email response for those who are willing to do so. I'm happy to put in some answers. I did put in a link to the paper that Gonzalo mentioned with Richard Manning and Ian. And Ian, gone now, and Ian Goldman. And so that paper's in the chat, but it'll go once the session finishes. We are posting the session up, and I guess on YouTube, and I guess the slides will be made available, but they'll also be there. You can see them again in the YouTube session. So thank everyone for attending today. Thank you everyone for taking part. So Annie, Ariana, Timothy, and Gonzalo, thank you for your time today. It's been a most interesting session. And to remind you, we do have sessions every day. It's midday UK time on tomorrow and Thursday and Friday for the last CEDIL conference. Thank you again. So have a good morning, evening, afternoon.
Thank you.
Wherever you are. All right.
Thank you very much.
Bye-bye. Thank you.
Yes, thank you very much.
Cheers. Bye.